Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Ibutilide. Ibutilide is a pure potassium channel blocker. So this ibutilide is not given in renal failure. This ibutilide is actually a very good drug used to treat the atrial fibrillation. It is a very good drug used to treat atrial fibrillation. This ibutilide is actually the only drug which is indicated to control the atrial rate of atrial fibrillation. In atrial fibrillation, there are many drugs which can be used to control the ventricular rate of atrial fibrillation or atrial flutter. But for controlling the atrial rate of for controlling the atrial rate in atrial flutter and atrial fibrillation, we can use ibutilide.
thank you and thank you for watching.